Ariana Traub, who will present a multi-country analysis of the impact of COVID-19 on HIV services for children and adolescents living with HIV for USAID. Ariana, you have the floor now.
Hello, my name is Ariana Traub. Today, I will be presenting our analysis on the impact of COVID-19 on HIV services for children and adolescents living with HIV on behalf of our team, Anouk Amzel, Megan Gleason, Nimasha Fernando, Mina Srivastava, and Alex Frazo from the USAID Office of HIV/AIDS Prevention, Care, and Treatment Division. Thank you to the International Workshop on HIV Pediatrics and the coordinators for the opportunity to present our findings today. This presentation was made possible by the support of the American people through USAID under PEPFAR. The views in this presentation are those of the author and do not necessarily represent the views of USAID, PEPFAR, or the United States government. The authors have nothing to disclose. The COVID-19 pandemic has created a unique challenge for health systems across the globe as they adapt to new social distancing policies. Since March 2020, USAID PEPFAR-supported countries have adapted programs in an effort to continue supporting children living with HIV, or CLHIV, through testing, treatment, and case management. This study assessed the impact of these COVID-19 restrictions on HIV services for CLHIV. USAID PEPFAR data was analyzed from 13 countries, comparing the relative changes from fiscal year 20 quarter 1 to fiscal year 20 quarter 3. Or October 2019 to June 2020. This study looked at the overall volume of testing, the number of HIV-positive children identified, linkage to antiretroviral therapy or ART coverage, as well as viral load coverage and viral load suppression rates. For this study, children were defined as less than 15 years old. 13 countries where PEPFAR USAID is supporting CLHIV services were selected for this analysis. These include Burundi, DRC, Eswatini, Haiti, Kenya, Lesotho, Malawi, Mozambique, Nigeria, Tanzania, Uganda, Zambia, and Zimbabwe. Here, we are looking at the overall testing volume, number of positives, and number new on ART. On the x-axis is the 3 quarters in fiscal year 20, from October 2019 to June 2020, while the y-axis is the overall number of children. The total number of children tested for HIV dropped by 40%, or 119,416 tests, from fiscal year 20 quarter 2 to fiscal year 20 quarter 3. Additionally, the total number of CLHIV who were identified as positive also decreased by 22.3%, or 1,608 children, from quarters 2 to quarter 3. Despite the decrease in numbers of CLHIV who were identified as positive, the percentage of positive tests, or the positivity, increased from 2.4% to 2.7% from quarters 2 to quarter 3. Additionally, the percentage of children linked to ART, or the proxy linkage, which is defined as the number of new CLHIV divided by the total number of CLHIV who were tested positive in that quarter, increased from 94% in fiscal year 20 quarter 1 to 105 and 104% respectively in quarters 2 and quarter 3. When looking at the second and third 95s of the treatment cascade, we notice that the overall number of CLHIV on ART increased by 7.2%, or 12,408 children from quarters 1 to quarter 3, but with noticeably less growth from quarters 2 to quarter 3. The viral load coverage, or the percent of CLHIV on ART who received a virologic test, decreased across the quarters, from 80.9% to 76% from Q1 to quarter 3. Of those who received a virologic test, the percentage of those who were virologically suppressed, or the viral load suppression rate, increased from 70.6% to 74.5% from quarters 1 to quarter 3. To summarize, our results show that across 13 PEPFAR-supported countries, HIV testing volume, the number of CLHIV who were newly initiated on ART, as well as the viral load coverage rate all decreased from fiscal years 20 quarter 1 to fiscal year 20 quarter 3, October 2019 to June 2020. However, the HIV positivity rate, the viral load suppression rate, as well as proxy linkage all increased across these 3 quarters. Retention of CLHIV on ART was maintained across the 3 quarters. Importantly, the decrease in overall testing, but increase in positivity, may be a result of more targeted testing of those children presenting to the clinic with symptoms and reduce non-targeted facility-based outpatient department testing, resulting in a higher positivity rate. However, additional analysis is needed to fully understand this result. Based on these data and current PEPFAR recommendations, we encourage countries to continue to prioritize safe and effective services for CLHIV during the COVID-19 pandemic, including scaling up index testing, targeted testing at sick entry points, improving access to caregiver-assisted HIV self-testing for children who are over the age of 2 years old, scaling up multi-month dispensing of ART, ensuring children are receiving optimal ART regimen, as well as providing virtual case management when available. Thank you very much for your time today.